Hello, I'm Dr. Jeffrey Nisgoda. We're here again in Milwaukee at AZH Wound and Vascular Center. As you're aware, we like to bring to you the cutting edge technologies in wound care, new products, new procedures, and new thoughts on how to manage patients with wounds. I thought you should be aware that there's another aspect to wound care, and that's the concierge practice. Wound care practitioners should be well versed in the ability to take our skills and apply them to concierge medicine, doing things outside of the box from wound care. And we're going to illustrate that to you today. I was presented with a very lovely lady that is getting ready to embark down the road of marriage, and she obviously wants to look her best prior to walking down that aisle. She's a little concerned about a mole that she had here on her back, as you'll see, and she is wanting to have that removed. Now, she could go to a dermatologist or a plastic surgeon or any variety of physicians, but when she wants the best, she comes to AZH Wound Center for the skills of a wound care physician. And really, this type of procedure should be something that all wound care practitioners can accomplish. So we're going to do a removal of this lesion. We're going to start with a little prep of the area. This is some betadine. We obviously don't need to prep the entire back, but just around the wound. Then remove that betadine with a little alcohol pad. And we're going to take a little lidocaine with some epinephrine and inject just underneath the lesion. Sorry, a little poke. You see the lesion rising there. We're putting a wheel of the anesthetic underneath the lesion. Typically, you can tell you're not having an effect from the epinephrine when you still have dermal bleeding like that. You see we're still oozing from the injection site, so that really suggests that we haven't had good anesthetic control yet. This lesion is fairly small in size, and there's two ways of doing it. You could do an ellipse type of excision, or we could just do a lift and sort of a pinch graft where we're going to go ahead and lift the lesion and excise right underneath. So after we've numbed the area, I'm going to go ahead and grab this lesion. We're just going to come underneath it fairly superficially. See, we've taken the lesion off at the base. It's a fairly superficial biopsy. And we'll just approximate those edges. Like so. You can see how well that comes together. And we'll tighten that just a little bit. And we are done. The lesion's been removed, the site has been closed with a single suture. She'll have a very nice cosmetic effect. Be able to walk down that aisle without having to hide that mole from the audience and from her family and friends. So I hope you enjoyed this edition of the Wound Care Window and a demonstration of how using skills as a wound care practitioner can expand your practice and include some concierge medicine. Thanks for joining us. We'll see you on another edition of the Wound Care Window.